The Focus RT clinical trial.
My name is Krishnan Patel, and I'm one of the radiation oncologists here at the NCI, and I'm the principal investigator of the Focus RT trial.
Can you share more about this trial?
The current standard treatment of prostate cancer is either surgery or radiation. This includes either the removal or radiation of the whole prostate gland. However, many people now seek out focal therapy options in hopes to decrease the side effects of treatment. This is an approach which targets only the area of the prostate with cancer as opposed to the entire prostate. The Focus RT trial was developed to test a new type of radiation called stereotactic body radiation therapy, or SBRT. In this trial, patients will undergo treatment to the area of their tumor only, as opposed to the entire prostate gland, as this change is expected to decrease the risk of side effects. The goal is to determine how effective this new treatment is.
What type of cancer is this trial for?
This clinical trial focuses on treating men with prostate cancer.
What is the purpose of this trial?
The purpose of the Focus RT trial is to see how people with untreated, localized prostate cancer respond to focal therapy with SBRT.
Who is eligible?
Adult men are eligible for this trial if they have localized prostate cancer which has not spread outside of the prostate gland and have not had any treatment. Men with multiple prostate tumors are not eligible for focal therapy.
How do you determine if a patient may be eligible?
We do a panel of tests, including blood tests and MRI, a PSMA or prostate-specific membrane antigen-based PET-CT scan, and a biopsy to determine if you are eligible. For the PSMA PET-CT, an experimental radiotracer specific to imaging for prostate cancer will be used to assist in your treatment. We also do a special type of biopsy at the NCI to provide us with a detailed map of your prostate cancer and ensure that the planned focal treatment would not miss any areas concerning for cancer.
How is treatment for the trial administered?
First, small, non-radioactive gold seeds about the size of a grain of rice will be placed in and or around the tumor to help target the radiation therapy. Then we will take several scans in order to plan the radiation treatments. The Focus RT treatment is then delivered in 2 separate radiation sessions, which will occur about 1 week apart. These sessions are painless and consist of a participant lying flat on a table for about 30 to 45 minutes, while a machine called a linear accelerator delivers radiation. Participants are not radioactive after the treatments, and they can continue their usual daily activities between and after sessions.
Can you describe the timeline of this trial?
Patients and their loved ones often ask me what is involved in participating with this research study and the timeline. This study lasts about 2 years overall and has 3 distinct phases. You will come to the National Institutes of Health Clinical Center in Bethesda, Maryland for eligibility screening, study procedures, and follow-up evaluations. During the first phase, the screening phase, we evaluate your eligibility for the Focus RT treatment by building a detailed map of your prostate with the combination of MRI, PSMA-based PET-CT, and a mapping biopsy. After this, if you are eligible, you move to the treatment phase. The treatment phase includes a set of planning scans followed by 2 radiation treatments spaced about 1 week apart. Finally, after trial treatment, we will closely watch you with regular follow-up visits in our clinic at the NIH Clinical Center, first at 1 month and then every 3 months after the trial treatment. During our clinic visits, we do blood tests as part of the study to watch your prostate cancer. We will also watch you closely with additional MRIs at 6, 12, and 24 months, as well as PSMA-based PET-CTs at 6 and 24 months. Finally, after 2 years, we will do a surveillance biopsy to determine if any residual tumor remains. After this study, you may also be eligible for additional follow-up in our clinic, as well as a separate clinical trial.
What are the follow-up requirements for this trial?
We will watch your prostate cancer closely for 2 years after the treatment. This includes repeat PSA blood tests, MRIs, and PSMA-based PET-CT scans. After 2 years, we will do a biopsy to determine if any residual tumor remains.
What are some of the possible side effects of this trial?
Radiation therapy can impact bowel, bladder, and sexual function. However, unlike surgery, incontinence or leakage of urine is very rare after radiation therapy. The chance of getting side effects from radiation therapy is related to the amount of your body with which receives radiation. Part of the rationale underlying the development of the Focus RT treatment is to minimize the amount of your body which receives radiation, to thereby decrease the chance of side effects.
Is radiation-focused treatment?
Oftentimes, patients will ask me what the difference between Focus RT and other standard courses of radiation therapy is. Historically, we have not had the power to see individual prostate tumors. However, with new technology, including PSMA-based PET scans, MRIs, and targeted biopsies, we can now reliably map the prostate and determine where exactly the tumor is within the prostate. This has allowed us to develop a new concept of treating prostate cancer, which we are testing in the Focus RT study. In this image, we see a comparison between a standard radiation treatment on the left and a tumor-directed Focus RT treatment on the right.
The image on the left shows a scan with a large pink circle around the tumor, indicating that the area of radiation in the standard radiation treatment is large. The image on the right shows a scan with a smaller pink circle around the tumor, indicating that the area of radiation in the focused radiation treatment is smaller and more focused on the tumor.
This outlines the difference between these standard treatments, again on the left, and treatment on Focus RT on the right. The treatment paradigm allows us to treat the problem area while decreasing the amount of healthy tissue receiving radiation, as you can see. This is done in hopes to decrease the side effects of treatment. We also often get the question, is radiation a focused treatment? All radiation treatments are designed to target a specific area, but the area that is radiated can vary. In other trials, we irradiate the whole prostate gland. In this trial, we are irradiating just the tumor.
Where can patients find more information about this trial or enroll?
You can learn more about the Focus RT trial by visiting clinicaltrials.gov, ID number 05616650. If patients are interested in participating in this trial, or if you are a physician that may have patients who are eligible, you can email us at radiationreferrals@mail.nih.gov or call us at 301-451-8968 to reach our research nurse coordinator, Debbie Nathan. We encourage you to write down any questions you may have and bring those questions with you to your appointment.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER.